Hey everyone, welcome back to our channel. Today, we're exploring the CABANA trial, which examined whether catheter ablation provides significant benefits over medical therapy for patients with atrial fibrillation, or AF. Let's dive in. Here's the bottom line. In patients with atrial fibrillation requiring treatment, catheter ablation was not associated with a significant reduction in death, disabling stroke, serious bleeding, or cardiac arrest compared to medical therapy at 12 months. Now let's break down the major points. 1. Catheter ablation is a common strategy for rhythm control in AF patients. Landmark trials like CASTLE AF and ATAC have shown its benefits in patients with symptomatic systolic heart failure, improving both quality of life and overall mortality. 2. The 2019 CABANA trial aimed to determine if AF ablation has similar benefits in the general AF population. It randomized 2204 patients to either catheter ablation or medical therapy, with the primary endpoint being a composite of cardiovascular events. 3. At 12 months, catheter ablation did not significantly reduce the rate of death, disabling stroke, serious bleeding, or cardiac arrest. 8.0% in the ablation group versus 9.2% in the medical therapy group. 4. While catheter ablation resulted in a 48% reduction in recurrent AF and a 6.4% absolute reduction in death or cardiovascular hospitalization, mainly driven by reduced hospitalizations, it did not significantly affect the primary composite outcome, or 5. A notable 27.5% of patients randomized to medical therapy eventually received ablation, while 9.2% of those randomized to ablation received medical therapy. This crossover may have diluted the observed benefits of ablation. 6. Patients who actually underwent ablation had a 23% relative reduction in the primary outcome and a 32% relative reduction in overall mortality. However, these analyses are subject to selection bias and should be considered hypothesis-generating. 7. An accompanying report indicated that catheter ablation improved quality of life and symptom burden more effectively than antiarrhythmic therapy. Let's look at the study design and population details. Design: prospective, multi-center, open-label, randomized controlled trial. Participants: 2204 patients, 1108 to catheter ablation, 1096 to antiarrhythmic therapy. Setting: 126 sites in 10 countries. Enrollment period: November 2009 to April 2016. Median follow-up: 48.5 months. Primary outcome: death, disabling stroke, serious bleeding, or cardiac arrest. Population: inclusion: patients aged 18 or older with electrocardiographic evidence of AF requiring active therapy and eligible for catheter ablation, and at least 2 sequential rhythm or rate control drugs. Exclusion: patients with prior failures of more than 2 antiarrhythmic drugs, recent myocardial infarction or cardiac surgery, severe cardiovascular disease, and other specific criteria. Here are the interventions and outcomes. Interventions: patients were randomized to either catheter ablation, isolation of all pulmonary veins, with additional techniques at the investigator's discretion; medical therapy, initial rate control followed by rhythm control if needed. Outcomes: primary outcome, no significant difference in death, disabling stroke, major bleeding, or cardiac arrest, 8.0% versus 9.2%. Secondary outcomes: catheter ablation showed a reduction in recurrent AF and cardiovascular hospitalizations, but not in the primary composite outcome. Adverse events: catheter ablation, cardiac tamponade, 0.8%, minor hematoma, 2.3%, pseudoaneurysm, 1.1%, medical therapy, thyroid disorders, 1.6%, proarrhythmia, 0.8%. Criticisms of the study include modification of the primary outcome mid-trial due to slow enrollment and lower than expected event rates. High crossover rate, potentially underestimating the benefits of ablation. Treatment received analyses are subject to selection bias and should be considered hypothesis-generating only. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more updates. See you next time.